Hey, everybody, and welcome to the Outsource Advantage, the show where we help you understand how outsourcing can give you an advantage in your business. I'm really excited about today's episode, which features our guest, Steve Jourdan. Steve is the CEO of BedWatch, a powerful suite of cloud-based patient throughput management tools. Since founding the company in 2010, Steve's really demonstrated the ability to not only identify industry trends in the market, but also create technology solutions to streamline hospital operations across the board. I'm really excited about this because his expertise makes him a standout guest. And without further ado, Steve, welcome to the show.
Thanks, Derek. Happy to be here. Excited.
Yeah, great. Well, look, I'm excited to jump right into this conversation. So I'm going to kick us off with a pretty general question. What was really the problem set that you saw out there that prompted you to create and found BedWatch?
Sure. Well, interestingly, we didn't really start off to build a software company. It was initially started, HHS came and said, we need better visibility and reporting around inpatient discharges. And so I was tasked with going out and finding that solution. So kind of long story short, we ended up building it ourselves after trying to partner with a couple different vendors in the market. And then we essentially created our own product, and we got great reviews, and it's expanded significantly from there, as I'm sure we'll get into.
Yeah,
That was
that's
our
great.
initial kickoff.
That's great. So you went out to the market, you didn't really find what you needed, and you decided to build it yourself.
That's right. We actually partnered. We did try to partner with a couple different folks. One was a bigger company, one was a startup company, and it just did not meet our needs. We've got some, as you know, we've got really specific needs for reporting and engagement with our staff, and specific requirements from the customer being hospital. And we realized that in order to meet those challenges, we had to build it ourselves. So that's what we did. And at the time, that was kind of when cloud-based technology was kind of becoming a thing. We're all used to that now, but back then it was sort of a newer thing. So we started with building on those tools. So we were one of the first companies to get, those tools, which is interesting.
That's great. And I know, as I mentioned at the intro of you, it's a suite of tools. Can you elaborate a little bit on kind of all the components that go to build BedWatch and at a high level, what that functionality provides from each of those modules?
Sure. Yeah, I'll give you kind of the 40,000 foot view. So at a high level, BedWatch at this point now is kind of built to break down the silos. We provide a lot of automation, visibility, data for the end users. So kind of think of it sort of like in a few different buckets. One is like air traffic control for nursing. So nurses can have full visibility of the entire hospital. They can see which patients need to come in, which patients are going out. A lot of indicators about specific, patient condition status. For the clinicians, that's what that looks like. From the service teams, think of it kind of like Uber for support service teams. We're arming those team members with mobile devices, so when something needs to happen, they can respond right away. They can update their status. Managers can see exactly what's going on with them. And then even from there, based on a lot of customer feedback, we kind of built we call community portal, community gateway, which essentially helps hospitals improve their referrals that are from outside the hospital coming in, to engage that surrounding community. And then and kind of baked in with all those tools, we've added a lot of automation. So, to basically have, when this then happens, it triggers something, as an example, when a transporter takes a patient out for a discharge, as an example, that can trigger an automatic notification to EVS to go clean that room. And then once that's completed, can trigger a notification to nursing to let them know, hey, that room is ready for the next patient. So think of it kind of like a workflow engine for patient throughput for facilities. So
that's great. I know from an operations perspective, obviously it does a tremendous amount of streamline tasks, automate, what I would almost call intelligent automation to, in how the process works. But, on the flip side of that, while streamlining operations, how does BedWatch really impact the hospital's bottom line?
Sure. Yeah, it's there, when you look at that, it really impacts their patient flow overall. So think of it in terms of like ED hold times. That's a big KPI they're looking at. When that can impact their bottom line too, like, you're reducing you're left without being seen, or patients leaving, AMA. You can impact your length of stay because, you're getting information about when is the discharge order written for that patient, how long is it taking nursing to get that patient out, how long is it taking for EVS to turn that room over and getting it ready for the next patient. I mean, if you can move your peak discharge time back in the day by an hour or two, you're effectively adding bed capacity to the hospital without actually adding, beds.
Yeah, that's a great point.
There's a lot of other things too when you start thinking about like clinical indicators that you would see on a bed board, like observation status. We have observation timers, and so clinically they have to make a decision on whether or not to admit that patient within a certain amount of time. If they don't, it can impact their bottom line. Indicators like, for things like, what type of, line does the patient have, PIC or Foley, those type of things.
Yep.
The amount of time that those are in can impact, infection rates. Indicators like, do I have renal beds? Is this patient a fall risk? Is this a one-to-one patient on critical care unit? So a lot of those indicators can help the clinicians make faster and more accurate decisions about where patients need to be moved and what their condition is.
Yeah, that's fantastic. Then on the flip side of that is, as you're talking about all of that, I imagine that this suite of tools, obviously if done right on the operations side as well, I'm imagining it has an impact on helping nurses, what kind of is the favorite phrase of today's healthcare industry, keeping nurses working at top of license. Is that a fair statement?
Yeah, sure. It sure is. When you think about outsourcing and using technology, if you, for example, if you can have patients stay on the floor, excuse me, for discharges. So in some facilities we see nurses wheeling patients out and they're waiting down the lobby with the patient, for that patient to be picked up. Well, meanwhile, that patient's off the floor. And so when you start to engage with the service teams and you're essentially giving them mobile devices, they become their Uber driver for the patient and taking them out. So they're wheeling them down there. They're waiting with the patient. So you're keeping those nurses on the floor and available to take care of those patients. And so that's one example of how that might.
Yeah, that's great. Yeah, that's wonderful. And then on the flip side of that, if you talk about three of the random hot buttons in healthcare, right, would be nurses top of license, obviously with the crunch on nursing staff coming out of the pandemic. But then, and you already talked about bottom line, but then a third would really always be around patient experience, right? How what we're doing in a hospital, whether it's technology, whether it's other programs, et cetera, impact patient experience. And so I guess two-part question. How does BedWatch help impact that patient experience? And then how does the data and all of the reporting help improve that level of care? So you kind of have both sides of that patient experience, clinical side plus their overall satisfaction level.
Sure. Yeah, that's a great question. Well, really, so to zoom out just for a quick second, what we do is we sort of act as a layer that's on top of the EMR. So hospitals have these EMR systems in every hospital. These EMRs are designed to basically, so you can document on the patient, meet regulatory compliance, those kind of things. The care coordination about patients moving through from the ED to the inpatient units and step down and treatment areas and discharge, those systems, that wasn't their primary function. And so we act as a layer that sits on top of those EMR systems. And what we can do, even with hospitals that have various EMRs, like some hospitals are using Epic and Cerner and Meditech, and some hospitals have a varied, flavor of all those within the same health system. We act as that layer. We can be that piece that gives consistency across the whole organization for the enterprise. But as it relates to specifically your question about patient experience, it's from a patient perspective, it's reduced wait times. So because of that consistency in that data, hey, that patient, we can get a patient moved out of the ED more quickly and into that inpatient bed. Or a patient now can move from a an ICU or a critical care area to a step-down unit more quickly, and that frees those beds up. So really, it's about wait time. It's about getting the patient to the care faster, and having
Yeah.
that visibility makes a huge difference. Now, specifically about the data, we track data in several different ways. So we have data around the journey. So that is how long did it take for a patient to get from, the ED up onto the patient unit, or from PACU into an inpatient bed, or even internal transfer. So we track all that. Even discharges. We talked a lot about that. You get data around when is our peak discharge time. It's at 4:00 in the afternoon. Well, is our EVS? Do we have staffing at that time of day to make sure we meet that demand? And why is it at 4:00? Why is it not at 2:00 or 12:00? Well, maybe it's because that we track. This is when the doctors wrote the discharge orders, and it takes the nursing X amount of time to get those patients ready to leave. Or maybe there's a delay on the third floor. For some reason, the nurses on this unit have a process that causes them to take 4 hours on average instead of 2 in these other areas. Why is that? So you can use that data to really drive your performance improvement efforts. So there's that piece of it. It's that care coordination, that flow piece. The other piece I touched on before is those clinical indicators, around patients, like those observation status, what level of care the patient, conditional versus non-conditional discharges, isolation status, things like that. That data is really critical for the clinicians to be able to make better decisions. And then kind of the last part about the data is really kind of the management escalations. And so, hey, this bed hasn't been addressed. This is a stack clean. The folks on the third floor said 315's got to be cleaned. It's marked stack. Nobody's been in there to address it. It's been 15 minutes and nobody's picked it up. Why not?
Yeah.
So that escalation can go to the manager to intervene. The system really works in a very automated fashion where you don't have, if things were working, managers don't have to get involved. It just works. So when things don't happen, we're not meeting our KPIs, then it can send a note to the manager or the appropriate clinician, depending.
That's great.
So,
Speaking of data, actually in every industry now, obviously, but, especially in healthcare with the amount of personal information in those items, what does BedWatch do to protect that data? Because I can, as you're out talking to CIOs, CTOs, et cetera, I'm sure that comes up quite a bit, and the propensity to protect that data as best as we can. But how does
Sure.
BedWatch really, what strategy do you use to protect the data?
Well, that's a great question. It's kind of a multi.
And mind you, we try to keep these podcasts short. So let's not get all the data layers behind that, but just for our audience members here.
Yeah, when you talk about security, there's really a lot of layers to that. So
Yeah.
they're from the development standpoint. We have a development pipeline. We do security audits. We have our whole platform's got kind of these AI agents that kind of sit inside and monitor everything to make sure that if there's anything that's unexpected or out of the ordinary, we get flags in real time, and our engineering team can respond to those. But more from an end user perspective, well, first off, HIPAA, there's a lot of regulations around how specific data is treated. And so there's really specific guidance and requirements on how that needs to be handled. So encryption in flight, as any data moves, between, the application and our servers and the customer and our servers, that data is encrypted. Encryption at rest, we do that. Now on the authentication side, we can support seeing sign-on. So we have large customers where they might have thousands of nurses and they need to be able to log in. Well, managing users is a big challenge, but if they've already got all those users in their Active Directory, they can essentially click a button and log in, so they can handle it that way.
That's great, Steve. I don't know why everything doesn't use single sign-on. I think on a weekly basis, I reset the passwords to multiple different things about 12 times. And I never write them down or use, as you've instructed me before, get some sort of password keeper. And so I feel the pain if they have to remember one more password or log in. So
yeah, that's right. So there's a lot of other things we do from the security standpoint. I mean, I'll get into the weeds. We have a whole page on our website that kind of talks about a lot of those things. So security is a huge deal, and we literally have security meetings every week to talk about.
Yeah, that's great. I guess, kind of transitioning anytime you're putting a software package or solution into a new customer, or whether, no matter who it is, sometimes getting the user adoption of that is almost more critical than the software itself, in my opinion. And so can you talk to us a little bit about how do you train and then support your customers to use BedWatch to ensure that once it's installed, it's implemented, we're actually getting the benefit of it, so it's not just sitting there and no one's using it?
Yeah, that's a huge deal, right? Because, there's lots of software out there that you can buy, but at the end of the day, if the users don't engage with it, then you made that investment for nothing.
Yeah.
So, there's a lot of things you do in the implementation process. We do a lot of discovery at first, make sure we understand what we're walking into, what the current processes are. Then we propose an updated process when we put our technology in. That's coordination a lot of times with the CNO and the clinical leaders and then the support
Gotcha.
service teams. What's working, what's not working. We go in there and put our systems in. We provide lots of documentation and webinar training before we ever show up. And we would have a help center built into the platform. So if somebody wants a quick video on how do I mark a good stat, they can just watch that in 30 seconds.
Oh, nice.
Oh, okay, I see how to do that. But then there's a period after we do webinar training, we show up on site and we help the hospitals through the transition. And then it doesn't stop there. Then there's a follow-up after. So we have kind of an account management team after the implementation team leaves and completes the install. There's a handoff to our account management team. And then they pick it up from there. And then we do frequent check-ins. It's usually monthly. Sometimes more frequently after if a brand new customer is just coming online, they're still getting used to it. So it's account management and support teams. And so we will help them print out reports and say, hey, we noticed here's your discharge times now. Here's how you get to these reports. We have sets of best practices that we recommend to let people know, like here, if you're trying to get the most out of your discharge management process, for example, here are some tips and tricks and reports that you could run and bring this information to your bed huddles, talk about this, those kind of things. So we really, it's kind of a multi-pronged approach because we don't just sell software and walk away. We try to stay engaged with our customers. And as a matter of fact, most of I would say 95% of the innovation that we've made within the platforms, which has been tremendously exciting, is all been feedback from our customers.
Man, Steve, that's an amazing segue, because where I was about to go is, how has BedWatch evolved over since 2010 and inception, and that those changes really been driven more by the feedback you're getting from your customers, your partners, or industry trends. How do you, as you talk about the innovation you've included and where it's gone, what's been the key driver of that?
Yeah, great. Well, I mean, just it's customer feedback. So again, we started with the discharge. We kind of talked about that discharge piece. That was basically, and when we talk about customers, it's essentially, we have an internal customer, which is our support service, company. And then we have our external customers, which is the hospital and the clinicians who are trying to deal with patient care. But we started with discharge management. That's near and dear to everybody's heart, getting those rooms turned, as you know. So we started with that. And then we started getting feedback. What we really need now is transport technology. How can we arm these transporters with mobile devices so we can respond really quickly when a nurse needs a patient moved from the unit down to radiology for a procedure, whatever it is. So we build a transport, and we actually have a patent around the technology around how we do dispatching, because we came up with an innovative approach so that we can kind of help really shorten the kind of response time that the clinicians experience there. So that happened. Then
that's great.
Then what happened was we started to get feedback from the clinicians, and they said, your discharge board is great, but we really want to see all these different clinical indicators. Like we want to see isolation, fall risk. Does a person on cardiac monitor? Is this a behavioral patient? Does this patient on tele? All of these things. I want to see a length of stay indicator, and I want to see any notes related to level of care and those types of things. And so we started taking all that feedback, and so we needed actually a new module. So we built our admin, and that's that admin control. That's that air traffic control board essentially. And now that's kind of turned into the ability to do custom bed boards. So nurses now can go in there and they can pick the columns they want to see and create their own bed board. After that, we had a really engaged ACO who we worked with at one of our hospitals. And he came to us and said, BedWatch, we really want to do a better job of engaging with our surrounding community of providers. How do we do that? How do we improve our referral capability? We love your technology, but can we use this piece to build that? And so we said, that's a great idea. So literally it started in front of a whiteboard, and we sat there and we drew it out. We said, explain to us what your challenges are and how you want to solve this. And we went from concept to creating our community gateway product. And in the first year, they saw and maintained a 60% increase in their patient referral rates because they had a much stronger engagement with that community. Because essentially they would refer a patient, and the next phone call that the referring physician would get would be from the accepting physician, and they loved it, and it really anyway. So it's just really been a lot of feedback from our customers. We have an amazing team of developers and just a really passionate group. But we also got to maintain humility. Like, we don't know everything, and even if we were clinical experts, you still got to listen to your customers and find out what they want, what matters to them. So, yeah.
That's fantastic. I mean, getting that kind of feedback straight from the customers better than any other way to have your R&D roadmap built, right? Well, then, obviously from the last 14 years, you've made a ton of improvements, multiple modules. Given kind of where the industry sits today and where technology is going, where do you see BedWatch heading in the next, let's call it 5 to 10 years?
Sure. Well, I don't want to sound cliche.
And try to answer this without using artificial intelligence in it. No, I'm joking.
Yeah. Yeah, I don't know if that's possible. Well, more and more we're getting feedback about data. People want to see data. I want to see more data with this. I want to see, BI tools. I want to have my dashboards in front of me. So where the industry's going, I mean, it's all about AI. But AI, is dependent on having data. So you have to train these models. And so you need to have good data. And so we spend a lot of time thinking about how do we structure our data? How does that go into our warehouse? What data are we recording? How does it need to be structured so that we can provide the reporting in the dashboards the customers want to see? So it's going to turn from here's your static reports about what happened in the past to predictive, where, hey, what do I, and this is one of the things that two of our customers has approached us about, and actually a couple of different customers. As an example is nurse staffing. They're like, right now, post-COVID, nursing resources are a big deal, and it's a problem. And so we need to do a better job of managing that. So we've got all the data on capacity, but they want to be able to tie that in with their timekeeping system and they want the system to predict, do I need to bring on more nurses now, or is it time to call them off based on demand? So it's that predictive, analysis you can start to do with the data that you have. And we're literally processing, millions of transactions every day, coming in from the feeds, the integration that we get from the hospitals. And so we have certain restrictions that we have to follow based on how we use that data, because it's not our data, it's the customer's data. But some of that can be identified and start to, make predictive analysis. And so one of the other things we've done is we've built what we call a snapshotting engine. So essentially it takes a picture of the hospital, of what's going on in the hospital right now. So every hour, think of it like a snapshot. We're taking a picture. So, and this is something that's in development. But the idea is, if a customer comes to us and says, man, the wheels fell off the bus last Thursday at 2 p.m. in the afternoon. We had a big problem. We had a big spike. It took forever to get discharges. Things were going wrong. What happened? Well, you just rewind and go, look, well, the ED was totally full. We had no inpatient, we had no med surg availability, and we had a lot of patients, coming out of surgery and stuff at that time. And we were short staffed on these units. And so that's what happened. And that's why. Yeah. So now you can start to make decisions, go, well, what do we need to do to mitigate that next time? How do we handle those spikes? Maybe that's more in the weeds than you wanted to get, but that's
great. Yeah, that's fantastic.
So
If I was a administration in a healthcare system, and I was interested in BedWatch or a similar solution out there, what kind of questions or path would you have them walk down to determine if BedWatch would be a good fit? What are those key things they should think about or key things they should ask out in the industry?
Yeah, great question. Well, one of the first things I would say would be integration. Okay, so we talk about nursing and how there's a shortage. I mean, nurses are incredibly busy. Those are a dedicated group, but essentially what you want to be able to do is provide automation tools that don't require a bunch of extra clicks and people to go in there to enter all the data to maintain them, right? You want it to be automated.
Yeah.
That's the whole point. So tight integration, for example, being able to pull order, AAT messages and orders and all that. So all those indicators that I mentioned before, having those be automatically updated. So you don't have to have a user go in and click a button to make sure that's in there. It just comes across automatically. So integration is huge, and the ability to do that is I'd say critical. Another thing is, of course, functional features, kind of knowing what you're looking for. What are your primary KPIs you're trying to solve for? Is it ED hold times? Is it discharge times? Is it length of stay you're looking at? Those kind of things. Do the functional features help address those KPIs? Obviously, as we talked about, and you brought up a great point, user engagement, user experience. Is the system actually easy to use? That's a huge deal, and I think it's often underappreciated. That's a piece. And then I would say, I guess, kind of the last thing might be just call on your references. Call other people that have used the technology platform and just ask your counterparts. Have the CNOs call their clinical counterparts, say to the support service teams, how does it work? Does it actually meet the needs? Yeah. Something like that is probably what I would.
Yeah, that's great. Over all these years, what's something that you would probably say that you're most proud of achieving in your role? It could be a loaded question because you've done a lot.
Yeah. Yeah, that's a good question. I guess kind of two parts to that. And the thing that I'm most proud of, the most that gives me the most personal satisfaction, I guess, is seeing the people that work in my groups, kind of grow professionally and personally, in their roles over time. I get a lot of satisfaction by seeing them be able to grow and prosper. So that's great. The other thing that I think that really makes me really want to enjoy my position right now is taking an idea from concept from a customer. Like we talked about that whiteboard session we had with that ACNO, taking it from concept to reality, and then actually seeing it working in production and actually making a difference as it relates to patient care and the clinician's experience. There's just nothing more satisfying than that. I gotta say that's great also.
Yeah, that's great. I wouldn't know. I come up with a ton of ideas and then never know what to do with them. So they just go back in the trunk somewhere. So it must be nice seeing those through to fruition. And then I always like to end with something that's more on the personal side. And so, can you tell our listeners and audience members out there something you're passionate about outside of work?
Yeah, sure. Well, Derek, I enjoy
data. If you say data, it's ruined.
Derek, I would say, long walks through the data center. I like that. No, actually, personally, I really enjoy traveling. I like working with my hands. Mountain biking is a big passion of mine. So I like to do that. I do it outside, get on the bike, spend time with family, those things. So
that's great. Well, Steve, I really appreciate you having on. Great conversation. Probably could have gone 2 hours with this, and we left out a lot of the powerful things that BedWatch can do. And so, looking forward to bringing you back on to get in some of the weeds as we go and evolve the software system. But for everyone out there listening, hope you enjoyed listening to Steve, CEO of BedWatch. And if you haven't done so yet, please subscribe. And thank you for joining the Outsource Advantage. Everyone, have a great day.